Welcome again. What could be the cause of painful ejaculation and possible symptoms? It can be alarming to experience pain with ejaculation. It's supposed to be a sweet moment. And in some people, the condition can be persistent or very severe. And at times, it might be just once in a while or, one-off thing. Painful ejaculation is also known as male dysorgasmia, and it is a relatively common condition, and it's affecting about 10% of people with human penises, either in acute, so that is sudden and short-lasting episode, or on a prolonged or a chronic or ongoing or recurrent basis, right? And when we're talking about painful ejaculation, it's also most of the time we refer it as dysejaculation or dysorgasmia. So, and when we're talking about this, when we're talking about the painful ejaculation, it is not funny. And most of the time, the causes are so many, ranging from infection to prostate problems, nervous system disorder, some medication, anxiety. You have a whole lot of things that causes this. That is why it is very vital to see your healthcare provider so that they'll be able to pinpoint the exact cause. And of course, when they are able to know the exact cause, they will be able to give you the right kind of treatment. So, and when we're talking about the symptom, we have some symptoms of painful ejaculation. And when we're talking about painful ejaculation, is a common yet largely unreported symptom in those people with penises. People don't like to talk about it. And of course, the pain can occur during or one or both stages of ejaculation. Number one, that's talking about the symptom. It might be the emission phase, when the sperm and fluid are simultaneously being injected from the testicle. That time might be the pain. You understand? Then from the testicle, the prostate gland, and the seminal vesicle, you understand, to create sperm. It is that time that someone feels the pain. Then the next symptom is the expulsion phase. That is when the muscles in the pelvic floor contract repeatedly because they are trying to pull to prepare the semen through the urethra. That's a tube through which urine also exits the body. In your body you have the ureters, you have the urethra, but this one is the one that brings both the sperm and the urine. Then, when we're talking about this painful ejaculation, it refers to the pain at times in the penis, in the urethra that we're talking about, and the pain might also extend to, or in some cases, it might be isolated to the testicle, to the scrotum, the lower abdomen, the perineum, the space, that's the space between the anus and the genitals. You understand? Then talking about painful ejaculation, the pain at times might be so severe, but with male ejaculation, the pain can range in severity from like dull ache dull aching pain to excruciating pain, depending most of the times on the underlying cause. And of course, at times the pain might last for a few seconds or up to 2 days, 3 days, or more than that. And in addition to pain, there might also be evidence of blood in semen, which is being referred to hematospermia. You understand? So you should be able to know what is happening to your body. And when we're talking about this painful ejaculation, there are a lot of things that differentiate it from other type of pain in the male reproductive tract. You understand? And some of the things that differentiate is that the pain arises as the direct result from orgasm and ejaculation. That is the only time, not all the time. And causes of this painful ejaculation can occur for various reasons. And in some cases, the cause may be unknown. We call it idiopathic. We have done all manners of things, taken all manners of history, but it's still the cause is still idiopathic. Though originally, causes are ever life threatening because painful ejaculation can significantly impair a person's self-esteem, you know, make you lose your self-confidence. It can impair your quality of life, can impair your sexual function. So let's dive in to some of the causes that you need to know, you understand, so that you'll be able to give your doctor accurate history when you get to the hospital. One of them is lower tract infection. And when we're talking about lower tract infection, there are those infections that involves your bladder, the bladder neck, the urethra, the prostate gland, and some, of course, muscles called urinary sphincter, just by the opening of your urinary tract sphincter that will regulate the flow of blood. And of course, it might be inflammatory conditions like that can be caused by viral, bacterial, or fungal infections, which can, of course, affect the male reproductive tract, including the testicles, the prostate, the urethra, the epididymis, and that's the narrow tubes through which sperm exits the testicle. And of course, this can also be sexually transmitted infection like chlamydia, the gonorrhea, the syphilis, the trichomoniasis, and all that. And other also further bacteria can be present in the semen or the seminal fluid. And when that happens, this semen infection can lead to some symptoms of prostatitis and painful ejaculation. That's the inflammation of the prostate and painful ejaculation. And of course, the infection can trigger inflammation in different reproductive organs. And when it does, it can lead to several things. One of the things that it can lead to is orchitis. That's inflammation of the testicles. It can lead to prostatitis. That's the inflammation of the prostate. And of course, the prostate gland, it can lead to urethritis. That's the inflammation of the ureter. That's the place that your sperm and your urine comes out from. It can lead to inflammation of the epididymis. That's epididymitis, inflammation of the epididymis. And there are also non-infectious causes of this condition. So it's not all of them that are infectious in nature. So that is the reason we should see our doctors, including prior urinary tract infection, prior urinary tract surgery, chemical irritant, prolonged cycling, or horse riding. Irrespective of the cause, the inflammation of this reproductive organ can easily trigger ejaculation pain. So you don't want to joke with yourself. And of course, enlarged prostate can cause it. And enlarged prostate, also known as benign prostatic hyperplasia or hypertrophy (BPH), is also a condition that commonly causes. It affects older men anyway, older males, and of course, it can cause pain with urination or frequent urination or nighttime urination, and of course, other urinary symptoms. Then another thing that can cause is prostate enlargement, and this prostate enlargement can cause pain after ejaculation. Then another point is obstructive condition. When we're talking about obstructive condition, certain conditions can block the pathway, you understand, or let's say the passage of sperm or the passage of the seminal fluid from the body. And when the flow is being obstructed during ejaculation, the forceful pressure can cause extreme shooting pain and even urethral bleeding some of the times. And some of the possible causes of obstruction that we know can be urethral stricture, that is the tube carrying the sperm and the urine can be obstructed. That stricture, they can narrow. The narrowing of the ureter caused by infection can be caused by inflammatory diseases. It can be the ejaculatory duct obstruction itself. That is the blockage of the ejaculatory duct itself. And this ejaculatory duct is the one that transports sperm to the urethra. You understand? And it can occur with a urinary tract infection or something. So it can be urinary tract cyst or seminal vesicle calculi, like it's similar to kidney stones, but it is not kidney stone, but they are like calculi. And these are also hardened deposit of minerals so that can obstruct your seminal vesicle. That's a gland that a gland specialized in producing seminal fluid. It can be as a result of inguinal repair. And of course, the final cause that we want to talk about is pudendal neuropathy. When we're talking about pudendal neuropathy, it's also known as pudendal neuralgia. And this one is just a chronic pain caused by damage to the main nerve servicing the pelvis. The main nerve servicing the pelvis, we call it pudendal nerve. And it is most often caused by nerve compression or entrapment. So when you notice that you are having painful ejaculation, my friend, my dear, it is better to see your doctor for proper evaluation, assessment and evaluation. See you in the next video.